In 2007, the CDC conducted a national survey and found out that Latino youth were more likely to feel sad or hopeless, to seriously consider suicide, and to attempt suicide at higher rates than white and African American youth. Other studies have also found that Latino youth had higher rates of depressive symptoms and other mental health disorders. Many factors affect a person, or in this case, its group's susceptibility experiencing mental health issues, but I wanted to focus on how being a first-generation Latinx student and the acculturation stressors that come with that impact the experiences with mental health. Acculturative stress is a stress that is caused by the challenges related to adopting life in the United States. This includes things like learning a new language, adjusting to new social norms, different family dynamics, and experiencing discrimination and racism. According to Potocznik and Pereira and many other research articles, there is a positive association between acculturative stress and many internalizing behaviors such as low self-esteem and other symptoms of depression and other mental health disorders. Speaking from personal experience, there is a great feeling that you don't belong fully to either of your American or Latinx identity. We have this saying in Spanish that goes, ni de aquí ni de allá, translating to neither from here nor from there. On top of this, being an individual who has plenty of experience with many mental health issues throughout the past and currently, I feel like many of them have been exacerbated by my identity as a first-generation Latina student. I was curious to see how having a first-generation Latinx identity impacted other individuals' experiences with mental health. I am a strong believer that sometimes hearing people's stories and perspectives gives you a lot more qualitative insight than a page of statistics can do. I recruited some of my first-generation Latinx peers from Creighton and asked them to share their experiences with mental health as a first-generation student. Our conversations were prompted by the following prompts. There were many similarities and differences in the responses, of course, but some of the major themes that came up were a lack of awareness and education regarding mental health, especially growing up, negative social stigma surrounding mental health in the Latinx community, a lack of ability to be able to afford seeking mental health care, both financially and because of a lack of insurance, facing different pressures related to the dual cultural identity of being a first-generation Latinx student here in America, a lack of resources for mental health, especially in a school setting in the early years, all stated that there was a great need for more education about mental health early in their academic careers, since it was a shared experience that we all did not become aware of mental health issues and our personal experiences until we reached college. And simply just more education in general to bring awareness to the Latinx community. Having a support system, whether that be of peers or family, was a crucial thing to many of my participants. They all stated that having somebody to share and speak with about their mental health journey and experiences was such an important thing to them. They thought it was a great way to support other first-generation individuals by being somebody who was there to listen and to be able to guide them and just give them more advice. And just hearing from somebody with similar backgrounds just provided them with a lot of relief and just a safe space to be able to speak freely about their experiences. But enough for me. Let's hear some of the amazing responses I believe that will give us a small but powerful insight to this topic.
Yeah, my name is April, and I'm a third-year doctoral student in the school psychology program at UNL. I think education is essential to mental health, and I say that because in my upbringing, mental health wasn't talked about. It wasn't something that was on our minds. It wasn't something that we really knew. It was pretty taboo, and really the extent of mental health conversations were not necessarily helpful or accurate for me. And so once I had like a formal education, I had like the language to describe things related to mental health. And I think I didn't necessarily appreciate how important it is until I got to college and graduate school, where along with a formal education and kind of clinical training, you realize how important it is for you individually as somebody going through college and graduate school. So I think education and mental health go hand in hand in that way, in that you develop the language to describe experiences you're having, and then you also just gain more knowledge of what mental health looks like for you individually and what it might look like for the community you come from.
My name is Chelsea, and I'm a senior at Creighton. I'm studying psychology and Spanish, and right now I'm applying for grad school in counseling psychology programs. I think being first generation has impacted my mental health greatly. First generation individuals or students usually have a lot more opportunities and are accessing higher education a lot more and are having chances to pursue higher paying jobs. And I think a lot of our parents think that mental health struggles are a choice because we have these privileges that they didn't have, but being first generation brings about like different stressors that they didn't face and that our parents don't really understand. So I think even though I was able to go to Creighton, I was able to pursue this degree, I think also a lot of mental health struggles have stemmed from these opportunities, and so trying to like navigate how I view mental health and also like access to mental health is a lot different than what our parents may think.
My name is Jesus, and I work as a student success coach at a university in Denver. I graduated with my master's from Lincoln and got my undergrad degree at Creighton. Mental health was just never anything we really talked about or anything I really knew about. Not until college was when I started learning about what mental health is, what it means to have a bad mental health day, how other things can impact your mental health. Just because growing up, it was more so like if I felt sad or bad or anxious or whatever feelings that was, it was always okay, well that, you just kind of got to keep working hard to get over those feelings, or you got to keep doing something. And almost kind of like guilt surrounding it, like, oh, well, how dare you be sad right now, or how dare you feel anxious when a lot of people would love to have this opportunity that you're having. And so there seemed to be a lot of guilt being wrapped around my emotions, which in turn affected my mental health, because I would feel like what I was feeling wasn't valid, or it wasn't what I was supposed to be feeling. And just kind of that messaging of, you should be grateful, you should be very happy that you have this opportunity, or, other people have it a lot worse than you. Why do you feel this way? Just made me feel worse. And so I think it was just not a good environment for mental health in that sense.
Hello, my name is Efren. I'm a first generation Latino student, college student. Oh, really? I just graduated from Creighton. And now I work for a nonprofit in South Omaha. I feel like my Latino first generation identity plays a big role in who I am. I feel like it's the main, my number one thing that makes me who I am, because it's very important. My family is very important to me, and I find it important to take pride in that. Or I guess I've grown to just be more prideful of who I am and where I come from. But with that, it wasn't always an easy transition to that, because growing up, I felt like growing up here in the U.S., but having family from another country can be challenging, I feel, 'cause especially when you're looking, as you're growing up, you're just trying to find where you belong to. And I went to school, sometimes, for my high school, I was around many other students like me, but in elementary and in college, I felt like that wasn't the case. And that did play a factor towards my mental health, especially in college, because I felt left out. I felt like I didn't belong in a way, or I felt like I wasn't good enough to attend the school. But aside from that, with our first generation Latino identity, I think mental health can be affected with the obstacles of going to college, just figuring that out for yourself, not really having anyone else to kind of guide you. It takes a lot of ambition and initiative to kind of find that support, or find those parents, find those school parents that can be there for you emotionally and educationally, just to kind of guide you. Because having my parents, they supported me in college, but they don't, because they never went through that, they don't understand what FAFSA is. They don't understand the time management. They don't understand how much it is to study